Welcome, medical entrepreneurs. Today, we will discuss Methylene Blue, an essential and multifaceted medication with applications in hematology, neurology, critical care, and antimicrobial therapy. By the end of this training, you will understand its mechanism of action, clinical indications, contraindications, dosing, and safety considerations in patient care. Let us begin with the fundamental mechanism of action. Methylene Blue is a synthetic compound with a broad spectrum of biological activity. It acts primarily as a redox agent and an alternative electron carrier in the mitochondrial electron transport chain. This means that Methylene Blue enhances cellular respiration and mitochondrial efficiency, making it particularly useful in conditions of oxidative stress and energy depletion. In addition, Methylene Blue functions as a nitric oxide inhibitor by blocking soluble guanylate cyclase activity, thereby reducing excessive vasodilation. This is why it is sometimes used in vasoplegic shock or sepsis-induced hypotension. Furthermore, Methylene Blue inhibits monoamine oxidase, an enzyme responsible for breaking down neurotransmitters such as serotonin, dopamine, and norepinephrine. This has implications for its neurological benefits, but also poses risks of serotonin syndrome in certain patients. Methylene Blue has a range of clinical applications. The key indications for its use include 1. Methemoglobinemia. This is the most well-known use. Methylene Blue restores the oxygen-carrying capacity of hemoglobin by activating methemoglobin reductase, converting ferric iron back to ferrous iron. 2. Vasoplegic shock and refractory hypotension. In cases where sepsis, anaphylaxis, or cardiac surgery leads to severe vasodilation, Methylene Blue can increase vascular tone and improve blood pressure. 3. Neurodegenerative conditions and cognitive enhancement. Research suggests that Methylene Blue reduces oxidative stress, improves mitochondrial function, and inhibits tau protein aggregation in Alzheimer's disease and Parkinson's disease. 4. Depression and psychiatric disorders. Due to its monoamine oxidase inhibition, Methylene Blue has been studied for treatment-resistant depression. However, it should not be combined with other serotonergic drugs due to the risk of serotonin syndrome. 5. Malaria and infectious diseases. Methylene Blue has potent antiparasitic and antimicrobial properties, making it an effective treatment for Plasmodium falciparum malaria and some antibiotic-resistant infections. 6. Photodynamic therapy in oncology. Methylene Blue can be activated by light to produce singlet oxygen, which can induce tumor cell apoptosis in cancer treatment. 7. Lyme disease and Bartonella. Some physicians are using Methylene Blue as part of an antimicrobial strategy for intracellular infections, though further research is needed in this area. The recommended dosing of Methylene Blue depends on the indication. 1. Methemoglobinemia. The standard dose is 1 to 2 milligrams per kilogram administered intravenously over 5 minutes. If needed, a second dose may be given after 1 hour. 2. Vasoplegic shock. A typical regimen includes a loading dose of 1 to 2 milligrams per kilogram intravenously, followed by an infusion of 0.25 to 0.5 milligrams per kilogram per hour. 3. Cognitive enhancement or off-label use. In experimental settings, oral doses ranging from 10 to 50 milligrams per day have been used, though this remains investigational. When administering Methylene Blue intravenously, always use a slow push to minimize side effects such as nausea, chest pain, or dyspnea. Now, let us review the contraindications for Methylene Blue. Absolute contraindications include 1. Glucose 6-phosphate dehydrogenase deficiency, G6PD deficiency. Patients with this condition are at risk for severe hemolytic anemia due to impaired redox cycling. 2. Pregnancy, especially in the second and third trimesters. Methylene Blue has been associated with fetal intestinal atresia and neurotoxicity. 3. Serotonin syndrome risk. Methylene Blue should never be given with serotonergic medications such as selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, monoamine oxidase inhibitors, MAOIs, or tricyclic antidepressants, TCAs. 4. Severe renal failure. Since Methylene Blue is excreted by the kidneys, impaired renal function may lead to drug accumulation and toxicity. Relative contraindications include 1. Severe hepatic impairment. Methylene blue is metabolized in the liver, and impaired function may increase toxicity. 2. Pulmonary disease, such as chronic obstructive pulmonary disease or pulmonary hypertension. Methylene blue can cause pulmonary vasoconstriction, which may worsen oxygenation. 3. Severe cardiovascular disease. Methylene blue increases systemic vascular resistance, which may worsen conditions such as heart failure or severe hypertension. Before prescribing methylene blue, always evaluate the patient's history, medications, and organ function to minimize risks. The most common side effects of methylene blue include blue or green discoloration of urine and bodily fluids, nausea and vomiting, dizziness and headache, mild hemolysis in some patients, hypertension due to vasoconstriction. Severe adverse reactions are rare but include serotonin syndrome, methemoglobinemia worsening with overdose, and severe hemolytic anemia in G6PD deficient patients. To summarize, 1. Methylene blue is an electron donor, nitric oxide inhibitor, and monoamine oxidase inhibitor with broad clinical applications in hematology, critical care, neurology, and antimicrobial therapy. 2. It is most commonly used for methemoglobinemia, vasoplegic shock, neuroprotection, and antimicrobial therapy. 3. It should never be used in G6PD deficiency, pregnancy, serotonin syndrome risk, or severe renal failure. 4. Dosage varies by indication, with intravenous administration preferred for acute conditions. 5. Careful monitoring is necessary to avoid adverse effects, especially in patients with cardiovascular, renal, or pulmonary disease. Methylene blue remains a powerful and versatile medication when used appropriately. Understanding its mechanisms, indications, and contraindications ensures safe and effective use in clinical practice.